Hello and welcome back to the mental health series here at Living Waters Lutheran Church. I'm so excited that you have decided to join us this evening. We have with us Leonetta from the Mental Health Board of McHenry County. We heard from our friends at the McHenry County Mental Health Board last spring, and there's been some updates since then. So we're excited to hear from them again, how we can get involved and what are some needs in our community. And of course, if you need any help, if you want to reach out to our presenter, reach out to us, you can always send a message to this page that you're on currently. You can comment on this video, or you can visit our mental health website, which is linked in the description of this video, and there are more instructions there. Without further ado, I'm going to turn it over to Leonetta.
Hi, I'm Leonetta and I'm the Executive Director of the McHenry County Mental Health Board, and I'm pleased to be here today to give you a brief overview of the Mental Health Board and its resources and benefits. But first of all, before I get started, let me first give you a brief overview of some of the statistics that are involved with mental health, intellectual developmental disabilities, and substance use disorder. 1 in 5 people in the United States will experience a mental health disorder each year. A third of them seek no help, and half of them go untreated. When you translate that to McHenry County statistics, that means that over 61,000 people in McHenry County will experience a mental health disorder each year. And over 20,000 of them will seek no help, and over 30,000 of them will go untreated. When we look at intellectual and developmental disabilities, 1 in 10 have a family member with an intellectual and developmental disability, which means that over 30,000 people in McHenry County have a family member with an intellectual or developmental disability. And then when we look at substance abuse, 1 in 17 people have a substance use disorder, which you translate that in McHenry County, that's over 18,000 people that have over the age of 12 that have a substance use disorder. And again, these are the officially diagnosed. There's many who go untreated, and that many that don't seek help. So again, we know that those numbers are a lot larger. When we combine substance use and mental health disorders, 1 in 50 have both co-occurring disorder. So that means that over 6,000 people in McHenry County have both a mental health issue and a substance use disorder. The McHenry County Mental Health Board was tasked and is authorized to deal with these public health issues: mental health, intellectual developmental disabilities, and substance use disorders. Now I'd like to share my screen at this point and go through more of an overview of the Mental Health Board. The Community Mental Health Act that John F. Kennedy enacted back in 1963 was really the start of this. John F. Kennedy was a huge proponent of mental health and intellectual developmental disabilities. He had a sister, Rosemary, who was born with an intellectual and developmental disability and suffered from mental health disorders throughout her young life. The Community Mental Health Act was established in October of 1963. And what it did is it spun off House Bill 708 in Illinois, which was our Community Mental Health Act. And as a result of that Community Mental Health Act, in 1967, there was a referendum that was passed by voters in McHenry County that established this Community Mental Health Board and a levy for the purposes of providing mental health, substance use, and intellectual developmental disabilities funding for these services. It establishes a 9-member board. And again, currently we have a budget of about over $10 million, and we support over 35 agencies and 80 different programs and services within those agencies. We are governed under the Mental Health Act, and there's lots of duties under this act. So besides funding agencies throughout our community, we also consult with the appropriate agencies. We have a written plan, we execute programs, and we have an audit and compliance process where we review and evaluate the efficiency of these services. Again, there's many other duties under the Community Mental Health Act, but these are the majority of those. We are one of the oldest and largest mental health boards in Illinois, because we did start way back in the late 60s. 70% of all counties in Illinois have either a mental health board or a 553 board or a 377 board. Again, a board that is levying taxes to provide services in their community. These areas in white are the counties that don't have any kind of board associated with them. There is going to be the referendum this month. There's many counties that have townships that are on the referendum to have a 708 board this year, such as in Kane County and DuPage and Will. So there's many counties that are trying to get a 708 board established in their municipality or township with this voting season. Our mission is to lead and contract for quality behavioral health and intellectual developmental disability prevention and treatment services for all people in McHenry County. We have strong vision, values, and we have a 3-year plan. Our 3-year plan focuses on network enhancement and development, on promoting a comprehensive network of behavioral health services, and strengthening and supporting intellectual and developmental disability services. And we do a lot of advocacy, awareness, and we have strong leadership goals. As far as our operations, the board of directors and the mental health board staff conjointly perform the operations and the duties under the Community Mental Health Act. Together, we decide on the funding allocation cycle. And again, we have an annual cycle, which we take applications beginning in June. And then we review those applications after July. So usually in August and September, we're reviewing applications, the board and the staff. October, we award those applications, those contracts for the new year, which starts in December. So our funding cycle is December 1 through November 30th, and we take applications in June of every year. We have a 3-year CARF International Behavioral Health Network accreditation. This network accreditation, again, is for all our funded providers. So if we have some providers who may not have an accreditation themselves, they fall under our network accreditation. We also have mental health board driven meetings such as network council, quality management, intake coordinators, and we perform clinical reviews. We have compliance audits and outcomes and data reporting that we're constantly evaluating. We provide a lot of network training. And again, we are stewards to our taxpayers and hold very high financial standards. Our annual report for fiscal year 21 shows that our funding for mental health, intellectual, and substance use disorders, and that we fund them in a variety of ways through grants or fee-for-service or purchase of positions. Again, our funding process starts in June with applications, submissions, and ends with the board awarding those applications in October. And then the funding cycle starts in December. When we look at all the 80+ programs and services that we fund in McHenry County, it is a huge continuum of care, you know, from crisis services to counseling to, you know, assessments and treatment and day programs and support programs, and also transportation assistance. So there's a wide array of resources that we fund in this county. We also perform annual conferences and suicide prevention trainings. We hold quarterly meetings with school professionals. And again, as we stated, we have a plethora of trainings that we offer. If you look on our website, we have what's called a hot sheet. And that hot sheet will list all the training offerings that we have. Again, it's located on our website, and it is the hot sheet, and it'll have a listing of all the training offerings that we have. And again, that is available on our website. We are involved in so many network affiliated meetings, committees, and task force, really looking at gaps in services and improving care throughout the county. We're involved with industry affiliations, such as the Association of Community Mental Health Authorities. We are also involved with the Illinois Association of Behavioral Health. So National Council for Mental Well-Being. Again, a lot of industry affiliations that we're connected with. When we look at community service navigation resources, we think it's very important. A lot of the feedback that we get is people aren't sure how to access services. And we try to promote that throughout our agencies and throughout our website, but it's still something that we get on our surveys, that people aren't sure how to access resources. There's many ways. We have on our website, we have a resource directory, which I'll show you in a moment. We also have what's called the McHelp mobile app. So through your mobile device, if you go to the Apple Store and download the McHelp app, you will not only get the resources that we have on our website on your mobile device, but it also has a chat and a text feature associated with that. Also, 988 is the suicide prevention and crisis line. We also strongly promote those resources. 211 is an information referral line that is available to all McHenry County residents and beyond. And then there's Youth and Family Center. They're located in McHenry, but they're really for bilingual Spanish-speaking youth and families. And again, they're here for service navigation. Service Inc. works with intellectual and developmental disabilities. They're our gatekeeper for that. And then we have what's important when we look at service navigation, our People in Need Form manual. And again, that's something that if you are looking for resources, it is the 2022 that you can download, and it can be in Spanish or English, but it has a wide array of resources that are available. So let me first off start with our McHenry County website. So if we go to our McHenry County website, and actually I think I have to stop sharing there and start sharing the website. Okay, so if we go to our website, one of the first front pages you'll see is a directory. So if you were to search on this directory and you were to search for counseling, for example, you would pull up a slew of counseling providers that are on this website. And many people think, well, gosh, that's kind of limiting. It just has their address and name. But you need to click on one of the providers and it'll give you more information. Not only the address and name, but who do they serve? And what's the eligibility requirements? And what kind of insurance do they take? And do they serve the uninsured, as in this case, AID does? So again, a wide array of resources on our website. And again, you can find that on the first page of our website, along with upcoming events that we have. The McHelp app, as I talked about, you can download that on your mobile device. And the hot sheets are also listed there, as I had mentioned. And again, the hot sheets have a lot of educational opportunities on the hot sheets. Also, providers list employment opportunities, the ever-changing support groups. We also list those on our hot sheets. And again, the hot sheet is just a wealth of information of any new programs that we have offered throughout the county, and events and things that are happening throughout the county. So a lot of information that is continuously updated. You'll find the most updated hot sheet on our website. So I really would encourage you to do that. And I guess we'll end here with, as far as educational opportunities, promoting the January 28th People in Need Forum. So I talked about the People in Need, that is a great resource. There's a great manual you can download that has a hard copy of all the resources that we have in McHenry County that I would encourage you to do. Okay, so stop sharing that screen and go back. To our community service navigation. So there is a plethora of resources that are available at your fingertips that I would really encourage you to utilize for McHenry County. And to end, just want to say that this is our wonderful board of directors that we currently have. We did have some term limits that were up this year, and there will be a couple new board members that will be starting in January. And actually, our staff position is currently filled. So we have no openings at the mental health board currently. So that ends my brief presentation regarding the McHenry County Mental Health Board. We are located at 620 Dakota Street in Crystal Lake, Illinois. Please stop by at any time. You can also access us through our website, as I talked about, www.mc708.org. And our main office numbers is area code 815-455-2828. Again, you can contact me through this number or directly at 815-788-4364. It's been my pleasure to give you an overview of the McHenry County Mental Health Board. I hope this has aided in your understanding of what a mental health board is and what we provide, and the services and opportunities that we have for all residents of McHenry County. Thank you, and have a wonderful, wonderful rest of the fall. I wish you all a blessed Thanksgiving coming up and holidays coming up. So thank you all, and hope to see you soon.
Thank you, Leonetta, and thank you to everyone over at the McHenry County Mental Health Board for all that you do for our community. We're very thankful that you were able to give us some updates and some time this evening. We look forward to hearing from you again in the future and partnering in new ways. A update about the mental health series will continue on next month, as always, the second Monday at 6:30 p.m. This will go up on, new episode will go up on Facebook and YouTube. We will have with us next month the Salvation Army. Lieutenants Pablo and Nancy Rivera will be with us talking about some of their work in the mental health field, especially in this holiday season. You know them. You've seen them out there with the bells and the kettles. So I look forward to welcoming them to our series. As always, as people of faith, we close this time together with a word of prayer. Please join me. Holy God, we give you thanks for the McHenry County Mental Health Board, all the life-changing work that they do. Please help us to reach out if we need help. Please help us to assist those who are helping those who are in need. Let this series be a witness and a messenger of hope to all in need. We give you thanks, and we look forward to our time together next month. In your holy name we pray. Amen.